Hello and welcome to another edition of Mosaic, an African American perspective. I'm your host, Deborah Milo. The Maryland Health Connection for residents between the ages of 18 and 64 who don't have affordable health care or can't find health care through their employers or on their own is open for enrollment. And here to talk about enrollment resources available for Montgomery County residents is Alma Luna from the Montgomery County Department of Health and Human Services. Alma, welcome to Mosaic. Thanks so much for coming on today's show.
Thank you for having me.
I know that our viewers are probably excited about hearing as much as they can about how this works, but before we get started, can you talk a little bit about what your specific area of expertise is with this process and how you got started?
So I have been a certified healthcare navigator for going on 3 years now. It'll be 3 years in January, but it will be my fourth open enrollment.
Okay.
Open enrollment started 2013, so I rolled in somewhere in the middle of that. And so I'm going into my fourth one now. I've learned quite a lot since the beginning. Yeah.
I'll bet.
A lot of changes, a lot of goods, lots of ups and downs, but so far my expertise is in the whole program overall. Yeah.
So now you said the title was Navigator?
Yeah, Certified Healthcare Navigator.
Certified Healthcare Navigator. Wow, that's a mouthful.
Yeah, it is. We usually don't say the whole thing.
I can imagine. Yeah. So now, when did the Affordable Health Act actually begin?
So it's a federally mandated program that officially rolled out October of 2013. The law said that individuals needed to have health coverage. So each state rolled out a health exchange and decided to implement or expand Medicaid. So we're lucky enough that Maryland decided to do that, and they decided to hop on board with helping people with subsidies. So that rolled out October, and everyone had the opportunity to first get covered January 1st of 2014. Okay. So since then, people have been enrolling through the exchange.
Okay, so actually, what's the goal of the Affordable Health Act? A lot of people, to this day, you still hear mixed, mixed feelings and mixed reviews. What is the actual goal of the act itself?
So to get everyone affordable health care, to have everyone have access to it, to have everyone have the resources, whether in person, online, over the phone. There's a no wrong door policy here in Montgomery County specifically, so it's a team effort throughout the county. So it's not just your healthcare navigator that's going to refer you to the program. It'll be your social worker, it'll be your caseworker that will allow you to know what you're able to get, what services are available to you. So that's the whole goal, that every Montgomery County resident has the opportunity to at least explore their options and get covered.
Have you seen a lot of successes with the program?
Oh, yes.
Talk a little bit about those.
Over the last 3 years, there have been so many success stories of people who, without the ACA, would have never had the opportunity to have access to health care.
True.
I have very specific cases that will never leave me. I've been doing it for a while now. There's a gentleman that I had he's a work permit holder.
Okay.
Pre-ACA, that specific category of legal immigrants did not have access to affordable health care. Now, he ended up on a heart transplant list. He would have never even known had he not had the access to the health care to be able to get covered and to be able to now seek the services. And he's doing much better now. He's been a client of mine for 3 years now, but cases like himself that make me feel like what I'm doing is worthy, that this man left my office feeling like he's very grateful that he now has the opportunity to explore his options.
And so you keep hearing stories that are both, like I said, good and not so good about how it works or it doesn't work, or you hear so many mixed reviews. How do you deal with that when people come to you and they're saying, oh, something, I've had a problem getting onto the system or getting access? How do you deal with those types of situations day by day?
I serve them as best as possible. I mean, it's really hard.
Yes.
I understand if you have trouble enrolling from home, or maybe sometimes you try to get through the phone line and you're on hold for hours, and you come in person and maybe there's a wait there. But as long as when you sit down and I serve you properly and I explain everything to you in detail and you're not left with any questions in mind or any doubts, that's the best that we can do. And we really try our best to do that within the county.
And from what I know about HHS, it is you always give the best. I know that. Talk about a little bit about who is covered under the law.
So anyone, like you said before, anyone between the ages of 18 and 64 are eligible to apply through the health exchange. You have to be legally present. So that means you could apply with a work permit, you could apply with your permanent resident green card as a U.S. citizen, and you have to be filing taxes. That's the most important aspect about qualifying for the subsidy portion of this program, is that you have to be filing taxes for the year in which you are applying in.
Okay. So now, when does open enrollment end for this year?
So it will end January 31st of 2017.
Okay.
Yeah.
So what's different now than what you've noticed from when it first started?
There's a lot of changes for this year.
Okay.
I think the most notable difference is that one of our insurance carriers has dropped from the marketplace.
Is this something that's typical, or is it expected?
It's the first year that it's happened. You know, a lot has changed in the program in the last 3 years. So they're our first drop, and you know, a lot of other carriers reevaluated, but we don't necessarily see it as a negative thing, because consumers can still come in and look at all their other options in the same place and know that they're missing one, but it's not that notable to them that now they have one less option, because they have so many other plans to choose from. Yeah.
Now, was there a penalty? Are there penalties out there for people who don't enroll in the program?
Yes.
And I do want you to talk about that, because that's part of it. We want to always make sure we engage our citizenry with facts and information.
Right.
Talk a little bit about that.
So the penalty for 2017 has not officially been rolled out, but we can at least expect that it will be 0.25% of your income, because that's at least what it will be for 2016. So residents should expect it to be at least that for 2017.
Okay, so for someone who is employed and they're earning minimum wage, that can be a little tough.
Yes. But of course, we encourage applicants who are, you know, of the low-income population to come and apply, because a lot of times this program really helps you and really assists you in giving you affordable health care. So we don't want anyone to be found in that situation where they're being penalized, you know, some fee for essentially not having health insurance, when you could very well come in and get something very affordable that would be less than the penalty.
Okay, then, you know, I always want to do the compare, and I asked you earlier with regard to what are some of the successes. Tell me about some things that have not been as successful that you know that they're working on to change.
So the Maryland Health Connection application on Maryland Health Connection, throughout the last couple of years, we've gotten a lot of complaints that it's not as user-friendly. This year, that's definitely one of the things that we've worked really hard on improving. The Maryland Health Connection application online is much more friendly, user-friendly now. There's signs everywhere. Click here, enroll here, put your name here. We also have a Montgomery County website. It's montgomeryhealthconnection.org. And on there also, you can get all the information that you need. I think in the past, that's been the biggest issue, that if you want to do it from home and you're computer savvy, you have trouble, you know, navigating the system on your own.
I see.
Yeah, there's also an app now for smartphones.
I was going to ask you if there was an app. There's an app for everything.
Everything. So of course we had to jump on board. Yes. So now we have a Maryland Health Connection app that, as long as you have already created your account on the website, you can go on the app and you can upload your documents from there. You can check the status of your applications. You can change information like your address, who you're applying for. So we've tried our best to make it as easy, as accessible as possible for people to be able to apply.
It sounds as though you have. It really does. In the state of Maryland, it sounds as though that they're doing everything they can to make it accessible for folks as well.
Definitely.
So what part of this have you enjoyed? I know you've enjoyed seeing the difference that you can make into the quality of lives of folks, but what else do you see on the horizon, if you will, for this?
The amount of people that are motivated to still come in and enroll and ask questions. I mean, it's very encouraging to know that the word is actually out, and that people, you know, understand it enough that they want to come and really find out. They understand, you know, questions to ask their employers now. A lot of people were clueless that employers offered health coverage, or what the plans meant, what coverage details were even about. And now, even if you're not enrolling through the exchange, you can come and see an in-person navigator or an insurance broker and ask questions and understand yourself a little bit better.
So that's new.
Yeah, I appreciate that
No,
they
I
want
think
to know
everyone
more.
would.
Yeah, that they
Absolutely.
definitely want to know more.
And so folks come in and they're able to ask the kind of questions that they need to, and it helps them to be able to comprehend and understand.
Yes.
Because so many times there's a lot of miseducation and misinformation out there about how all of this works.
Exactly, yes.
Well, I still like your title, though. As a navigator, I think that's really, really important. Well, I think what we're going to do is take a quick break, and then we're going to come back and talk a little bit more about what it is you do with the Affordable Care Act and how we can get enrollment.
Great.
For those of you who've just tuned in, you're watching Mosaic, an African American Perspective, and I'm your host, Deborah Milo. I'm talking to Alma Luna from the Montgomery County Department of Health and Human Services. After a short break, we'll be back with more about affordable health care enrollment, so stay tuned.
I'm a retired school psychologist, and helping people was my thing. After my stroke, when Meals on Wheels started, I was on the other end of the stick, so to speak. And I appreciated it very much, the attention that was given. My name is Julius Gaines, creative writer, poet, photographer. America, let's do lunch.
Drop off a hot meal and say hello. Volunteer by donating your lunch break at americaletsdolunch.org.
You've messed up your son's haircut.
Mom?
Do you A, try to fix it,
Like it never happened.
B, work with what you got, or C, show solidarity?
Thank you, baby.
As a parent, there are no perfect answers. But you don't have to be perfect to be a perfect parent. Thousands of teens in foster care will love you just the same.
Please have a seat. I'll be honest. Your resume, not what I'm used to.
I know.
Okay, so what would you bring to my company?
What do you need?
I need a hard worker.
Good. I've got 2 part-time jobs and to help my parents pay the bills.
I need problem-solving skills.
I got through high school without a car, a phone, or a computer.
No college degree, though.
Not yet, but life's taught me a lot, and I'm ready for more.
Well, you're not the typical kind of candidate that I hire. But you are exactly what I'm looking for.
Your company could be missing out on the candidates it needs most. Learn how to find, cultivate, and train a great pool of untapped talent at gradsoflife.org.
Welcome back to Mosaic, an African American Perspective. I'm here with Alma Luna from the Montgomery County Department of Health and Human Services. Alma, before we went to break, we were talking about numbers with regard to how many folks here, residents here in the county, are actually enrolled. What's the approximation there?
Well, so far in the county, we know that pre-ACA, there were about 100,000 Montgomery County residents that were uninsured. That number has dropped down to about 75,000. So we think it's a big difference.
It is a big difference.
Between how many were uninsured and now are. Of course, the number of uninsured now does include residents who may not be eligible at all through to apply through the exchange. For example, if you do not have a legal status here,
Right.
you can apply. Of course, all those things are things to take into account when applying through the exchange and taking into account those uninsured numbers in the county.
So do the numbers in the marketplace still reflect that someone can get a plan for under $500 a month?
Oh yes, definitely. There are many factors that go in to when someone applies for coverage. You know, residents should know that although premiums have gone up, many factors like your household size get taken into account, your income, your age, the county in which you live in. All of these factors go into account when you apply for coverage. So premiums, you know, the original premium may be one thing, but when taking into account how many dependents you have and where you fall on the federal poverty level, all of these things could very well get you a very affordable plan. It's very rare that I see someone paying over $500
Right.
for a health insurance plan.
Well, typically $500 is what they call a healthy threshold.
Yeah.
For folks that are looking for health care, because I know that, when you decide to transition from job to job, or if you're becoming an entrepreneur, you're always looking for the best buy that you can get as far as health care rates are concerned.
Right.
So what is the county doing with regard to awareness about affordable health care re-enrollment?
So we have many partners that we work with in the county. They try to do as much outreach as possible to the communities, especially the multicultural communities, so that they're aware. There's also, it's very important to us that they know that there's a language capacity that those communities know that they can find when they come into the county offices.
True.
Just within our team, we have Spanish speaking, we have Amharic speaking, we have Vietnamese, Mandarin, we even have Russian. So
great.
It's important to us that these partners, and as well as everyone else that works for the county, lets the community know that they will be able to come in and get served, and someone feels more comfortable if they're being able to get served in their language. They understand things better. They feel more confident about choosing a plan for themselves if they can understand everything.
What do you see as the next move for the healthcare enrollment piece? I'm just curious as to what you see on the horizon for what's going to happen.
We hope it continues.
A lot of us do.
Yeah, we hope it continues. And we hope that people don't get discouraged. We hope that they continue to want to come and find out what their options are. We just hope that it continues to thrive, and that people are aware that although open enrollment ends, there is still the special enrollment period that we always try to get as much information out about as well. A lot of times people are under the impression that when open enrollment ends, that's it. There's no other opportunity to enroll, where that might not be the case. You may have life changes, like we say, life events that you would be able to come and report, and we hope that this continues to encourage people to always keep the program going.
And I want to encourage our viewers as well, the importance about healthcare insurance. Talk a little bit, albeit it's more of a sociological question, talk a little bit about why healthcare insurance is so important.
It's very important. You never want to be stuck thinking, what if?
Yes.
So if the options are available to you now, and the exchange makes it so that you can view all of your options in one place, get your whole family covered, regardless, you can even have your 26-year-old married son on your policy still. So, come and explore your options and understand that being covered does not mean just paying a premium every month.
Right.
You should be utilizing your insurance policy. You should be visiting your primary care doctor. Preventive care is covered no matter what policy you have, and the insurance carriers cover it. So it's extremely important for Montgomery County residents to know that even your basic health care coverage is covered as long as you have a policy. They should be going to the doctor and making sure that everything is up to shape, and not wonder, what if I end up in the emergency room? What if something happens to my husband? So we would hope that they understand the importance.
You mentioned something very important, preventative health care. Talk a little bit about why that's so critical, because we automatically think, okay, something happens, we just need to go to the doctor, but we seldom for some reason think about what we can do as prevention measures. Talk a little bit about how important that piece is.
Right, so your preventive care when you have an insurance policy are your vaccinations, your annual checkups. These things are very important for someone to go and visit their doctor for. Even if you shouldn't wait till you're sick to go to the doctor.
Exactly.
You should take advantage of that annual checkup, just to make sure and, have peace of mind. You should be visiting your doctor at least once a year. As long as you have, health insurance, it's covered. So it definitely gives you a good peace of mind
to do
does.
That. Do you find that there are, at times, that there are cultural norms that we have to kind of overcome a little bit in order to get people to understand why it's important?
Oh, yes.
You find that a lot?
Oh, yes, definitely. I specifically come from a Latin American background. My father, my whole life has said, well, I don't need to go to the doctor. I'm fine,
I think that's men in general.
Yeah, so,
just my opinion.
Yeah, so a lot of times,
yes.
the women or the mothers are the ones that are coming in to get a health insurance plan and making sure, and they feel relief.
Of course.
I will make him go if it's covered. Why not?
Yes.
So a lot of times we end up we're grateful that they're mothers and the women are the ones that are coming in, but we try to really bring up the point that it's very important. It's very important.
It's tough.
Yes, it can be very tough.
I think in all cultures that's tough. I really do. So what are 3 very important things that you would like to share with our viewers about the whole piece of the enrollment process? What are 3 things that you can think of that are the most critical that they should know?
I would say for this open enrollment, Montgomery County residents should definitely be aware of the December 15th deadline. That means that in order for you to have January 1st coverage, in order for it to start on that date, you have to have completed and chosen your plan by December 15th. That's an important deadline we'd really like to emphasize for this coming month and a half, so that residents know that they need to be coming in if they want to be covered by January 1st. I would also like to emphasize our Montgomery County website.
Oh, good, yes.
Yes, so you can go to that website. It's www.montgomeryhealthconnection.org.
Okay.
You can visit that website, and it shows you all of the resources you need to get it covered within Montgomery County. That also includes where you can find insurance brokers. We'd like to really emphasize that, yes, you can find in-person assistance in all of our Montgomery County offices, but you can also reach out to an insurance broker that would also be able to explain to you all of these qualified health plan options. There's actually a full list that you can search for by zip code.
Okay, by zip code?
Yes, by zip code. So any Montgomery County resident can go on there, put their zip code in, and you can find a full list actually at the MarylandHealthConnection.gov website. And that's also a very good option.
Now, you mentioned brokers. I want to make sure our viewers understand the terminology. What do the brokers do, or what does it mean? How does that work?
They are specific to enrolling into private health insurance plans.
I see.
Yeah, so if you really want to sit down with someone and take the time for them to explain to you all of the details of each policy, of each plan, who can be covered, who cannot, who can be included, they're definitely a good option. It's a very personal experience when you go to talk to a broker, because you're sitting down with them. It's like a one-on-one session with like an advisor, you could say.
Similar to when someone goes to talk to a financial advisor.
Yes,
but in this particular case, it's about healthcare insurance.
Yes, exactly.
I wanted to ask also, we talk about so many things that healthcare is involved in. What about women's health issues as well? That's going to be covered? Those types of things will be covered as well?
Yes, definitely. All of the preventive care also includes your annual checkup to your OBGYN. Those things are very important. When a woman comes in to apply for health coverage, we also want to let them know that you are legally present. So if you report that you are now, for example, pregnant, you can also get other services. For example, you can qualify for Medicaid through the state. You don't necessarily have to continue with your qualified health plan. And all of that can be determined through the exchange. So we really tried to emphasize the importance of them always coming in, reporting any sudden changes, any concerns that they have, any questions.
Okay, and this also includes immunizations, inoculations, and like that?
Definitely.
So what happens, I'm just curious, what happens from a cultural perspective when it comes to the immunizations? Because I've seen some instances where it's been very much a challenge to get folks who are not accustomed to having those. Do you find that to be the case as well?
Yes, and we hope that when they visit their primary care doctor, that the doctor also does his due diligence of explaining the importance of those things. So the first goal is to get them to the doctor.
Yes, exactly.
That's the first goal, and to also let them know that a lot of the flu shots, a lot of these things are even available outside of a doctor's office. So maybe if a doctor's office is what terrifies you, you can also find them in other areas. So a lot of times we also have events that also offer, like for example, the flu shot or things like that, or we'll refer you to another place for you to be able to get your vaccinations done.
Is that part of the awareness piece?
We'd like to, yes. We always try to do as much outreach and awareness when we have the client with us, and making sure that they're aware that there are other community clinics in the area also for those who might not be eligible for insurance through the exchange. Montgomery County has a wonderful program. It's called Montgomery Cares.
Yes.
Yeah, so there are community clinics that also are available to residents for them to be able to see a doctor and also get, medically covered so that they don't have to worry about not being seen by a doctor.
And I want to kind of reiterate to our viewers, how can one enroll and the website that they can enroll or get information even?
Right, so if you would like to self-enroll, do this from home, you can visit the website at www.marylandhealthconnection.gov.
marylandhealthconnection.gov.
Yes, yes. So there you would just create your account, and then you could go off and do the enrollment and application process on your own. Again, you can use the app as well after you've already created your account. And then there's always the in-person navigator assistance that you can find in any Montgomery County office that you could always utilize, and then as well as the insurance brokers.
Do you find that people, that our residents prefer to come in and actually sit and talk with an
certified navigator?
Certified navigator, thank you, yes.
We do find it. Our offices at this very moment are very busy.
I'm sure they
right
are.
now, so we do find it that, especially returning clients, they feel more comfortable now that they've come to the office, they've been seen by somebody who, is very knowledgeable. They feel confidence in returning and coming back. So I believe that they utilize all avenues, but they definitely like coming in person to see a navigator. Definitely.
And about how long does it take for a client to sit down with you and talk through the process? About how long does it take?
It can take anywhere between 20 and 45 minutes. We are encouraging clients to go see insurance brokers if they would really like an extended session.
Of course.
Of course, because our offices are very busy. So of course, if you want that personal in-person time, we are encouraging for you to look at that list of insurance brokers. But if not, anywhere between 20 to 45 minutes a session, I would say.
So our citizens have the opportunity to do one of the other.
Yes.
And it's good for those of us that think that we're computer savvy but may not be as much
Yeah,
as we
you would
think
be
we are.
surprised. Yes, you'd be very surprised.
I can understand. Well, is there anything that you'd like to leave our viewers with regard to the whole process?
Just continue to apply. I encourage you to continue to, be knowledgeable and come and find out what your resources are. And please definitely utilize our website, the Montgomery Health Connection.org, where you can find all of the resources that you may need in our county.
Okay, that's important. Well, Alma, this has been such a good experience, and I'm glad that our citizens now have a more adept view of being able to know what they need to do to get enrolled. Thanks so much for coming.
Thank you for having me.
Unfortunately, that's about all we have time for today. I'd like to thank my guest, Alma Luna from the Montgomery County Department of Health and Human Services. For more information about the Affordable Care enrollment process, please visit montgomeryhealthconnection.org. I'm Deborah Milo. Please join us again next month for another edition of Mosaic, an African American Perspective. Till next time, make it a healthy day.
My new dad teaches me all kinds of stuff.
I wouldn't use this one.
He helps me with my decision making.
Never.
And he's even teaching me how to drive.
And that's why cars have bumpers.
You don't have to be perfect to be a perfect parent. Thousands of kids in foster care will take you just as you are.
You've negotiated a good price for a car, and you have your financing lined up. But it's not time to drive off into the sunset just yet. First, the dealer may try to sell you add-ons. Add-ons are optional products or services, like rust proofing, fabric protection, gap insurance, or a service contract that cost you extra. One important thing to know about add-ons, it's okay to say no, or not right now. It's your money. The more add-ons you get, the more you're going to pay, which might break your budget. Your best move? Read up on add-ons before you even go to a dealer. You might find out that you don't need any add-ons, or you can get them later for a better price. And if there is an add-on you want to buy, don't be afraid to negotiate the price. When you're ready to sign the contract, make sure it only lists the add-ons you've agreed to, at the prices you were quoted. If a dealer isn't honest when it comes to add-on charges, let the FTC know. Want to know more? Visit ftc.gov/cars.
Be prepared. Storing water is smart, especially during the winter months.
WSSC averages 1,800 water main breaks a year.
So with all the other emergency preparation, remember the water.
Here's what you should have on hand. 1 to 2 gallons of safe tap or bottled water per person per day. Store enough to last each person at least 3 days. And don't forget the pets.
Check out WSSCwater.com/winterize for more tips.
WSSC, where water matters.